Alaskans are our neighbors. They're our coworkers, our friends, our family. And we need to set up a system so that when there is somebody that is in need, that they are having a crisis, they have somebody to call. And there's a place for them to go that is safe.
Many people in our region, only place they'll take them is the hospital or the jail. And so a lot of people that have crisis aren't calling for that help.
We have high rates of suicide. If we had something in Kotzebue, we'd have more people coming in, and I think we would have more people saying, hey, I'm scared, I need help, I don't feel good. Can you guys help me?
Oftentimes law enforcement, the uniform can just make things worse.
A lot of these folks don't need to be in the back of an ambulance or a patrol car, and we're trying to find root causes and connect them with different resources in our community that can actually help and break that cycle for them.
Why does this work matter? When it comes to mobile crisis, when it comes to behavioral health emergencies, we're a fire department, trained paramedics, EMTs, responding to this type of calls without the training. And so having a program in place with the right training and the right teams to respond to deal with these situations.
That's one of the things that the Crisis Now model represents, is something that we can build that will help pay for itself, but also add access in our home communities.
People are intimidated by the Crisis Now model, but your individuals are coming in, and it's better to have the appropriate care for them than trying to piece together a care that's not appropriate.
5 years ago, it took 8 months sometimes to get an integrated behavioral health assessment. Now you can get them same day. I mean, that's a huge improvement.
Just last year, we were able to help 90% of 3,600 calls stay in the community. That was 90% of individuals who didn't have to go to the hospital. You can look at it as we saved money, right? We saved Medicaid money or hospital visits. We also saved time for individuals, and we helped them have a better outcome.
Our model can't look like Anchorage. Our model has to be something different.
The relief is there initially of, oh, thank goodness, this is going to help. We're not going to have to get on an airplane and fly to another city. We're not going to have to worry about how we're going to pay for it. And the excitement of we can do this in our community and not have to wait until it becomes an emergency.
Having the mobile crisis team really alleviates calls for service from the police department side and frees us up to take care of law enforcement calls, whether it's thefts, burglaries, assaults, things of that nature that need our immediate attention.
We're challenging each other to be better, get better, communicate better. It's creating an atmosphere where programs can be built and sustained because they have referral sources and partnerships within the community that are helping people get connected to those resources.
The program truly makes a difference. They're helping individuals one at a time and really plugging them into the program.
Partnerships and collaborations are super important. Getting your local stakeholders for your community engaged, that's kind of where we started, is figuring out who we needed to be talking to, getting the mental health trust involved, how do we fund this, and what does the structure look like.
Just being able to plan and support each other has been really rewarding. As other parts of the system are standing up services, mobile crisis team, the call line, we're refining the services based on feedback from people using the system and improving that. That's really exciting. It takes all of us working together, doing our part, whether it's law enforcement, emergency room, crisis provider, crisis centers. It takes all of us working together to meet the behavioral health needs of Alaskans.
There are so many great organizations in Alaska, but there isn't one who can do all the things yet. If we really want to help somebody from a holistic approach in all of the areas that they probably need help in, we have to collaborate and we have to partner. Until our beds aren't full or their seats become empty, we still have work to do.